Hi all, welcome to Off the Cuff, and today we are going to talk about optimizing our health, regenerative medicine and personalized healthcare. I do have Atousa Habibi here with me. Welcome Atousa to Off the Cuff.
Thank you Namrita, pleasure to be here.
The pleasure is all mine. A little bit about Atousa. As a registered nurse for over 13 years, Atousa has multiple avenues of experience and accomplishments. She has many years of professional experience in the aesthetics industry as a lead injector. She has worked broadly in medicine with board certified OBGYN and plastic surgeons, oral surgeon, orthopedics and internists. Atousa helped build the company Lookout Health as the VP of Clinic Operations, a mobile health screening and diagnostics company started during COVID to increase access to vaccines and testing, where she ran a fleet in multiple clinics which delivered thousands of treatments. That's amazing, And congratulations on that.
Thank you.
That was a very difficult time for all of us.
Thank you.
Yes. And your true passion lies in regenerative medicine and personalized healthcare. As co-owner and COO of Biohacker Health, she has devoted herself to the health and wellness of her clients. Whether it's cognitive, aesthetic, sexual or physical needs, she delivers the best care and options for her clients, and she runs the clinical operations. So that was a little bit about her. Yeah. But tell me, what led you to the medical profession? Was it somebody in your family, or you were more inclined to serving people? A little bit about yourself.
So a little bit about myself. So my father is a urologist, now retired.
Okay.
So watching him in the medical field growing up, I was always intrigued in the world of medicine. It was a little bit different. When I was younger, I would see a lot of sick people coming in with problems and, watching my father cure them and help them and heal them. So I've always been somebody who's been passionate about healing and caring for people.
Okay.
So that's kind of why I went into the world of nursing. Yes. I did dabble in the thought of, becoming a medical doctor, but I feel like in the nursing world, you are closer to the patients and, you get a lot more one-on-one, I think. So that's what led me.
Yeah, it's more personalized, I'll say, Yeah, so what inspired you to get into the field of regenerative medicine and biohacking? Because the term biohacking is still new for a lot of people. Yeah, big buzzword. But what is it about?
So basically, with biohacking and regenerative, it's really being forward about your health and longevity.
Okay.
Kind of uncovering things that are going on within yourself.
Okay.
A lot of times in traditional medicine, you go to the doctor when you're feeling sick or there's a problem. Regenerative is more on the cellular level of things. Optimizing your health on a cellular level. If you're feeling tired, brain fog, all these different things, there's got to be a reason, getting to the root cause of it.
Right.
So we do a lot of diagnostic testing in the clinic to kind of unravel what's going on. A lot of people just come in and they're like, I just want to feel better. Absolutely. Not necessarily that they have a big issue or they're feeling sick, but they're starting to slow down, feel a little bit sluggish, so they're trying to get to the bottom of what's going on.
Yeah, optimize it as much as possible. And also it's like, getting more a personal care,
Absolutely.
One-on-one. But what are the misconceptions that people have around biohacking treatment?
Big misconceptions. I think a lot of times people think it's the end-all be-all. A lot of people don't really know.
Okay.
So, they listen to all the buzzwords that's going on the internet and they just dive in.
Yes.
I think the biggest thing with Biohacker that kind of separates us from that norm or that world is we really go deep into diagnostics. It's
important.
It's very important because the blood and the tests don't lie. It really gives us a picture of what your history is, what your present is, and what your future can be. So, and then we kind of create the plan from there. You know, the biohacking word is kind of a newer term.
Yes.
But it is, you know, just kind of tapping into your cells, tapping into your brain, tapping into the organs, and, you know,
Yes.
getting yourself feeling better.
Yeah. Hacking itself is gives a different connotation.
Right.
But yeah, so people say, what does hacking mean?
Yeah. But if you think about it from a computer standpoint, right?
Yes.
If you're thinking, okay, my computer's getting slow, there might be something going on, you send it through diagnostics.
Yes.
You run it through the program, see what's happening, you clean it up, and then now your computer is running optimized. It's kind of the same thing that we do for the human body.
Right.
So, yeah.
So, Atousa, you are on a Bolly 92.3 FM channel.
Yeah.
It caters to the South Asian Indian community a lot. So, tell us a little bit about your South Asian Indian clients. And, our community is predisposed to a lot of health problems, especially, diabetes and heart problems. So, a little bit about, your clients, South Asian Indian clients.
So a lot of the clients that do come in that are, our South Asian Indian clientele, they come in feeling burnt out.
Okay.
They've gained some weight, hair thinning has happened, they're feeling tired, the brain fog, they just feel off. We run the diagnostics on them. A lot of times, as you said, uncover heart disease, uncover, diabetes. That's why it's really important to do diagnostics. Cholesterol issues, a lot of cholesterol issues. Also deficient in iron, so anemia is a thing, big thing in your community. And also like B12 deficiencies. So we find a lot of that. And a lot of those things, they're, easy fixes.
Right.
But if you don't know what's going on, how are you going to fix it if you don't know what the problem is? So those are a lot of the things. Vitamin D deficiency.
Right.
Yeah.
Very
so
true.
Like
you hit the nail on the head, I'll say. But we were just talking about women health, especially in our culture.
Yeah.
Women don't give. I'll say they don't put themselves ahead of their health, especially ahead of anything.
Absolutely.
They will, delay going to the doctor, or they'll just make reasons that they're okay. And it's very difficult for women to come out and talk openly, especially about their sexual health or any other illness for that matter. I've seen, and I've gone through that myself, if at home, if the mom is lying down, the whole house will be, what's going on? Dad, it's okay, but mom doesn't need. So a little bit on that, and I know, but
I call it the silent sufferers.
Okay.
They suffer in silence.
Okay.
They put everybody else ahead of themselves. The kids, the family, the extended family.
Okay.
Even career. Now you have a lot of career-driven women and men who are, they just say, oh, I'm just tired, or oh, I'm just, I'm not feeling well, and they just push it under the rug. And we always try to promote get ahead of it before you're chasing it. So a lot of times when we have our clients come in, it's a lot of hormonal deficiencies. So we do, the diagnostics once again, uncover there's hormonal issues going on. We do a lot of hormone replacement therapy.
You do that, okay.
We do that with the guidance of Dr. Lori Bluvis. She's our CEO and medical director, and she's a OBGYN. So she understands that avenue better than she's the specialist in that sense. But it is taboo in the culture, and even in my culture. I'm Persian Iranian. You don't really talk about that stuff. You just kind of push it under the rug, and you don't really address it until it becomes a problem. And majority of the women, you just go along with it. But thankfully now the conversation is happening. People are talking about it more. It's becoming more of the norm. Hormone deficiencies can really disrupt and completely ruin you if you let it. I've watched my own mother suffer. She had a complete hysterectomy at the age of 51, and it threw her into a complete hormonal storm. And at the time, you're not talking about hormone therapy. Now the conversation is coming. So, you know, I'm thankful that we're in that world and that the conversations are getting a little bit easier.
Much better.
And they have a safe place like Biohacker to come and speak with the nurses, speak with Dr. Bluvis during a telehealth or seeing her in person in the clinic. That's, it's a big open opportunity for a lot of the women.
So before we go forward, can you tell where people can find you online or any information you want to give about
so we have 2 clinics.
Okay.
One of our clinics is in downtown Palo Alto. We are off Bryant and University.
Okay.
We're 540 Bryant Avenue.
Okay.
And then we have our second location in San Francisco off of Union and Laguna. And you can come in clinic. You can go online and find us, www.biohacker.health.
Okay.
Lots of information there. And then we also are on all social media platforms, Biohacker Health. And then I also have my own. It's I Biohack You. That's my handling.
I Biohack You.
Yeah.
Okay, and Biohacker is BIOHACKR.
No E, yeah.
There is no E. So, yes, do check them out online and definitely reach out to Laurie or Atousa, and they're wonderful people, and I'm sure they'll put you to ease. I know there are a lot of anxious patients coming in. It's not easy.
It isn't.
So
we have a really good group of experienced registered nurses who are in the clinic. That's going to be kind of like your first touch. You sit down with the nurse. You go through your health history, any issues, any problems that you're having, and then we create a solid plan for you. We can go as deep as cancer screening. We do coronary calcium scans. We send out for that. The nice thing is that when you come into the clinic, you're not being sent out to multiple labs to get lab work. All the lab work is done in-house, and then we send it out. We do NAD testing, which lots of clinics do not. We do that's a really good for brain health, cellular health, energy. I'm not sure if you're familiar with NAD infusions, but
I read on your website only, so I know a little bit about that. Now, talking about, you said you specialized in cognitive and aesthetics needs also. Can you talk about some treatments that, do there?
Yeah, so our NAD therapy is fantastic. We have 3 different modalities of that. We have IV infusions, we have injections, and we have the powder, which the powder is it penetrates intracellular. That is what you can actually be tested for to see what your NAD levels are. So myself, Dr. Bluvis, and Dr. Greenberg all took a test, and I'm the youngest of them, and I had the lowest NAD levels. So I was silently suffering and just no energy, brain fog, and then I started doing our NAD therapy, and I feel like
much better.
Yeah, like a plant got watered, when a withered plant. So cognitively, that's a good one. HRT is great for brain health. And aesthetic services, I mean, we have, you name it. We do Botox. We have a device called the Silphium X, which is microneedling with radio frequency. And one of the biggest things that I noticed that the South Asian culture suffers with is melasma. And this device actually treats melasma. So it's a great device.
Melasma is
hyperpigmentation.
Oh, yes.
Yeah. So hyperpigmentation are my same thing. We offer medical grade skincare products. And then we offer hair treatments as well. We have our own supplement line that is fantastic that we usually will put people on, which is great. And then we'll do the Silphium X actually treats hair as well. So any latest innovations in aesthetic medicines that are exciting and you can share? I would say exosome therapy is probably one of my favorites. We couple the Silphium X with exosomes that go on topically. We actually do microneedling for the face as well. One of the other, that's been around for a long time is platelet-rich fibrin and platelet-rich plasma, where we draw your blood, we spin it down, we pull the plasma, and we inject it and re-enter it back into your body. That has all the growth factors. So it helps grow the hair, it helps, regenerate the skin, great for acne scarring, things like that. We also use that for sexual health as well. So lots of cool stuff.
So, you've been doing it for some time now. Any story that, of a patient that you can share?
So we do a treatment that is probably one of my hands down favorite regenerative biohacking treatments. It's called the EBO2 or EBOO. It's extracorporeal blood ozonation and oxygenation. So it's blood filtering for the body. It's line out, line in, goes through a filtration system, and it cleans the blood. As it's cleaning the blood, it reoxygenates the blood with O3 and O2, goes back through a filtration, comes through a bunch of lights, and comes back into the body. So you get fresh, clean, healthy blood going back to your organs. So we've had a lot of patients who suffer from like mold exposure, Lyme's disease, you know, long COVID, inflammation, things like that. And I've actually seen clients as they've done the treatments, you could see the color in them get better. You can see them moving better. You can see them breathing better. So being able to like help people in that aspect from the inside out is hands down one of my favorites.
Okay, good to hear that. So what role do you think nutrition, sleep and lifestyle play, you know, in a person's life? I know you also stress a lot on preventative aid. And obviously when people feel down, then they come to you. But, you know, as a young professional, what advice can you give to people about their lifestyle and how to go about it? It's a very generic question.
But I mean, it's a very important question.
Maybe 50 plus women or whoever you can talk to.
I mean, generally, I think our audience is about 35 and above. But we are seeing people come in earlier and younger because they're trying to kind of get ahead of things and get, you know. I think the biggest thing is staying on top of your diagnostics is really maybe, we have people who come in quarterly and do their blood work. It's every 6 months, every year. Obviously, nutrition is a huge factor. And it's not just nutrition, it's making sure that the source of the food is good and you're eating clean food. That's huge. Sleep is hands down, that's when the body is recovering. So if you're not sleeping, your body's not recovering.
But that's what I hear, like even the younger kids are not getting enough sleep these days, you know, so it's difficult.
I think a lot of it is because the social media world and the constant scrolling and the clicking, so your brain is, so, you know, maybe shutting your phone off an hour before you go to bed, putting your phone away, it's hard to do because we're so attached to our phones. You know, and making sure you're supplementing. We also do a test, it's a micronutrient test where it'll tell you all the deficiencies in your micronutrients. That's important, so that's really big too, because a lot of people will get their blood work and their blood work is fine. Everything is normal, but it's not, because if you're feeling, you know, off, then something's off.
So one thing also, you said that you work with the, you know, primary physicians or specialists. And how does insurance work in certain ways and certain treatments?
So at Biohacker, we do not do not accept insurance. In some cases, we could take HSA or FSH. That could cover the treatment. But we do partner with a lot of specialists and a lot of primary care. We're not here to take the role of a primary care doctor. We're here to partner and create kind of a long-term plan for yourself, like a roadmap for the rest of your life.
Absolutely.
You know?
And that's the best part about, you know, these private clinics are time. You are, you know, because if you go from one specialist to the other, sometimes there's a wait of 3 months or 6 months, and, you know, your health starts to deteriorate at that time. And so if you want immediate, you know, attention or treatment, then I think hacker clinics are the way to go. And like you're saying, working inside out, you know, regenerating yourself in certain ways. So Atousa, it was so lovely talking to you.
You as well.
And one thing I'll ask you is one morning routine and one evening routine that you do for your health.
For myself?
Yes, for yourself.
Morning, I always take my NAD powder.
Oh, okay.
That's number one.
Okay.
Because it replaces like 3 cups of coffee for me.
Oh.
It just makes me feel alive and well, and I just feel really good.
Okay.
And so that's my morning. Nighttime, probably just sitting in silence, a moment of gratitude. You know, I think that helps you kind of shut yourself down. Yeah, I think that's
nice.
That's good. NAD and gratitude.
Gratitude. Yeah, I mean, you start with a bang and end in calmness.
Yeah, exactly.
So that's what I'll say. Yeah, definitely. Thank you all for again listening to Off the Cuff. And once again, you can go to biohacker.health
Correct.
online. Check them out. They are in Palo Alto and SF. And yeah, get in touch with Atousa or Dr. Lori.
We have telehealth. You can jump on. Yeah,
absolutely.
Telehealth. The nurses can do telehealth with
Yeah.
you. Dr. Bluvis will do a telehealth with you.
Okay.
That's kind of nice, you know, like you said, time, not
Yeah,
having enough time.
Yes, yes. So that's another convenience. So thank you, Atousa, once
welcome.
again.
Thank you.
Take care
It's a
and be
pleasure.
well. Bye for now.
Bye-bye.